I guess I want to go somewhere where I don't have to sit and wait for hours to be seen. And I don't want to call an ambulance because I don't want to be ramped for hours in an ambulance. I want to be in seeing a doctor and on my way home.
The Better Way Urgent Care research program through Flinders University is an exciting initiative for us here. This research program is trying to understand the needs of older Australians and First Nations people when they access emergency care. We know that for these populations they often find accessing emergency care quite daunting or unpleasant. And so what we want to do is understand their experiences and learn how to better measure that experience for those people. And in addition, we want to test new models of care, in particularly the CARE program here in the southern part of Adelaide. The CARE program is an innovative program set up where an ambulance will bring a patient to a non-hospital site and we will then assess and manage them to try and manage their needs without needing to go to hospital at all. I'm really proud of the research program here. This will deliver for the Australian community a set of measures and understandings that will allow emergency services across the country to better tailor their care for older people and First Nations people.
The most important thing to me is how long it would take to get that care, and then when I get it, do I need to wait and wait and wait to receive that care that I so badly want?
To understand the needs of people aged 65 and older, the plug-in engaged with 39 individuals who live in southern Adelaide. These participants told us what is most important to them when seeking urgent medical attention. Older people want access to healthcare 24/7, a calm environment, and services that prioritise their comfort.
I think as a senior person, which I am, and for anyone older, the environment is not good. It's too noisy, too busy. You have people yelling and, it's just not conducive to a calming situation for older people.
They also want clear and consistent communication, the ability to have a support person present, and medical staff who are specially trained to work with older people.
The perfect environment, and I say perfect loosely, would be a nice, quiet area. When I say quiet, not super quiet, I mean you can't have that, but maybe, pictures on the wall and a comfortable, homey feeling.
It's important that a service continues to communicate with people following discharge. This helps them feel confident when returning home, especially if they live alone.
Yes, gave me confidence that I'd be all right and go home and I'd be fine. And they do say go and see your own doctor, which we did. And the other thing is they give you a report, which I found I've never had that done before. They send a report to your doctor, but they give it to you as well.
Technology is a concern for some, however, health monitoring and communication devices are seen as valuable tools for managing ongoing health needs and accessing prompt medical attention if needed.
Well, the most important thing to me with my health, time is everything. So it's a matter of making sure I'm breathing. So if the ambulance is held up, I can't afford to wait hours.
I'm Sarah Collier. I'm a researcher at Caring Futures Institute, Flinders University. We interviewed staff at the urgent care unit and referrers to understand how the service has been working. The urgent care unit is staffed by a small, highly skilled, multidisciplinary team that specialise in the care of older people. Being a small team allows the staff to surround older people with support and provide person-centred care. The service is flexible and responsive, being able to treat older people at the centre or where they live and conduct follow-up visits allows the team to provide holistic and care that's tailored to the individual. Care is provided in an environment that suits the needs of older people, and it's far away from the chaos of a busy emergency department. Referrers viewed the urgent care unit and Eyes on the Scene as a valuable service that fulfills the urgent care needs of older people in the community.
Well, the important thing is comfort. I find that in emergencies you're sitting, depending on what's wrong, if it's not ambulance, You're sitting there, you might have hurt your leg, you might have broken something, anything. You're sitting in uncomfortable chairs, you're not comfortable.
I'm Maria Crotty. I'm the Professor of Rehabilitation, Aged and Extended Care at Flinders University. We're evaluating the virtual ward. So virtual wards use technology and they monitor blood pressure, pulse, temperature, and they provide hospital-grade care. That they allow you to have access to specialists. You can talk to a doctor 24 hours a day. And what we're interested in is this kind of care appropriate for someone who lives alone? Does it work for someone who's over 80? Can they use the technology? And we're also interested in whether it's putting a bigger strain on families. We need to understand exactly what is involved for the carers. The advantage of caring for people at home is that you avoid the potential risk of infection. Sometimes people get delirium. So if we can keep people at home, it is often better for them. We've treated over 600 patients in the virtual ward, and 30% of them are aged 80 plus, and more than half of them live alone. And now what we're focusing on is we're trying to do a deep dive into what is actually the carers' experiences.
I'm Tamara. I'm a Wallian woman and public health researcher at Flinders University.
I'm Shane. I'm a Guggatha man, and I work with Tamara in Aboriginal health research at Flinders University. Our role in this project was to find out the service delivery, experiences and preferences of Aboriginal people. As Aboriginal researchers, we often use different ways to ask and answer questions. For this project, we held 4 yarning circles with Aboriginal people in southern Adelaide.
Older Aboriginal people are motivated to use digital care so they can stay safely at home and continue to care for their grandchildren and avoid being traumatised by negative experiences at hospitals. They don't want staff and services to make assumptions about them that lead to representations to emergency departments. Aboriginal health practitioners have a role to play in ensuring that technology enables Aboriginal elders to stay at home safely when they are unwell.
I'm Christine Pundukambwa, a postdoctoral research fellow in health economics at Flinders University. Our research aims to assess if the new urgent care model aligns with the needs and preferences of older consumers. Accurately gauging these attitudes is vital for tailoring healthcare services to meet the unique requirements of consumers, ensuring patient-centered care. The tool is being developed through consumer workshops, a discrete choice experiment, and qualitative work. 1,000 older Australians participated in the discrete choice experiment to help develop the tool. Validation of the tool includes face-to-face interviews with 40 ED patients and psychometric testing with 400 online survey participants. After validation, the tool will be integrated into regular care and will be adopted by other urgent care services. The data collected by the tool will be used to inform care providers about older consumers' preferences. This will enable objective quality measurement of the service, potential international use, improving urgent care globally.
My name's Andrew Partington. I'm a research fellow with the Flinders Health and Medical Research Institute. And my role as the health economist on the team is to help those who make clinical and executive decisions think about value from the whole of system and societal perspective. So we do this by looking at data on costs, but more importantly, patient outcomes, to then build up a profile of how new services like the care centre are expected to have a real impact. So we do this to look at what's working well, but also think about into the future, how can we use our resources to make sure that everybody across the community is benefiting? Now, there's lots of good evidence to suggest that if you don't need to be at the ED, then it's better to avoid it because you can avoid a whole heap of disruptions to your day. But you can also then be helping to make sure that scarce resources are available for those who need them when they need them. So there's a direct benefit from having tailored care provided to you out of the hospital, but there's also an indirect benefit enjoyed by all those other people in the health system who can attend the ED when they need to.
ED's a terribly busy place and so much going on and so much noise. It was very calm, and the doctor was lovely and the nurses were lovely, and yeah, it was a lovely experience.
You probably got more individual attention compared to if you went to the ED where everything's happening, and this was much quieter, relaxed, and I think...
Yes, it was, and as they were wheeling me in, someone said, "We're waiting for you, Marlene, room 1. I thought, oh, how lovely.
These insights really help us understand what people are looking for from healthcare services, evaluate existing services, and better plan future services to meet people's needs.